Greetings, friends and colleagues. It's Sam Collins, the coding and billing expert for acupuncture, the profession, of course, the American Acupuncture Council, of course. I've got a little update coming up because obviously many of you have been contacting me, network members and even others have contacted me, say, hey, Sam, what's going on? I notice that they're not paying for exams and they're also still recouping. We're going to talk a little bit about that, but we have to update from what we did in April. So let's go to the slides. Let's talk about what's going on with recoupment and standard episode of care updates specific to acupuncturists and, frankly, non physician providers. So you'll see here is a letter dated June 23rd from TriWest, and it says, we received the above claim. Let me bring it so I can blow it up. And it says, TriWest received the above mentioned claim for your office, and notice I highlighted in yellow. It says, evaluation and management procedure codes are not payable for this rendering provider specialty. This is the latest thing we're seeing. It appears, and I've not seen it absolutely published yet in the way that to me would make it more clear, but it appears they have taken away the ability for acupuncturists to be paid separately for exams when it comes to the VA. That, of course, is very frustrating because, of course, is an exam a necessary thing? Of course. How do you determine the need for care? How do you determine the continuation of care? So what's really occurring, I think, is maybe a little DOGE cut here that they're eliminating the payment for exams. Now, that doesn't mean you don't need to do one. They're just not paying for it. I think it's probably still worth seeing the patient for the overall payments, but they are not covering it. We'll see here directly. Now, the word is that they did this in April. What I've seen published in when their newsletter is not quite clear enough for me, so I'm waiting to see the full publishing of the standard episode of care, but I'm sure many of you have noticed that. Now, here's going to be the pushback. If the exam is after April when they published it, they're going to be able to stand behind it because it was published. However, before then, I want you all to think of the standard episode of care for acupuncture. Whenever you notice the standard episode of care, you'll notice whether it's going to be initial, chronic, or follow-ups. They all include E&M codes. And you'll see real clearly, 99202 to 205, 99211 to 215, and I bet probably your authorization has it as well. So my argument's going to be, if they're saying they're not going to cover it, well, if it's after April and they send an updated authorization that it's not listed, I'm waiting to see that, then I would say, okay, but if it's prior, my dispute's going to be, how did you send me an authorization that clearly indicates exams, and then you're now not going to pay for it? Now, it appears after April, this is going to be true. But prior to that, it's going to be a pushback. Now, is that very frustrating? Of course it is. But I'm going to ask you, is it worth it to still be part of it? I do. Because think of the overall payment on a VA patient. You're getting 12 visits to start, probably 8 and 8 to follow up. Assuming you're doing 3 sets of acupuncture and a therapy or two, that's maybe $110 to $150 of reimbursement. Am I going to take away potentially, $3,000 to $4,000 of payment because they're not going to pay for a couple of exams? I prefer they do, but I'm going to say I'm not going to go that far. It's something I think, though, we're going to be fighting. I shouldn't say think. I know we're going to be fighting as a profession on a national level, along with chiropractors and physical therapists, because this affects them too, because this goes against the equality provision. Equality says that if it's within scope and you pay, other providers have to pay you because this is not Medicare. Now, that's going to be a little bit of a fight, and that's not going to happen in short term. So when you get this, I do think we should dispute it. I would certainly push back if it were pre-April that they should. If it's after April, not so much. Of course, if you're a network member with me, reach out. We've got some letters for that as well. But I do want to highlight also beyond that, just a couple of quick updates. Let's talk about what's happening and what's gone on with doing things with 97039 or 139. And that's, of course, what a lot of offices have used for cupping. Remember, that was removed more than a year ago. So please do not use that code for cupping. It is not appropriate. Do not list it. They may pay it, but they're going to recoup it. So do not. If you're going to do cupping, use 97016, which is a vasopneumatic device. It's not a high payer. It's about $11 to $15, but at least you are being paid for it. But again, do not use 97039. And if they are recouping that, if it's pre-2024, I would argue they can't. But if it's after 2024, they can. Now, some people have argued, well, what about statute of limitations? Well, statute of limitations, I would argue, certainly does apply. Unfortunately, you know what I've realized or what I've learned? The statute of limitations for the VA is actually 6 years. So we're not going to win on that one as far as this goes. The other thing here is, and this has come up recently because obviously a lot of you are using pain indexes or similar to verify how the patient's improving. Well, I recently had an office, or actually a few, that they were denied further care because they weren't showing at least a 7-point difference on the general pain index. I really like the general pain index. It's certainly similar to the pain interference. Make sure, though, if you're using it, if you're doing it once a month, there's got to be at least a 7-point change to be considered significant. Now, most of you, I hope, are getting bigger than 7-point changes, frankly. But if you're not, realize it's going to be a problem because they're going to push back, which means you also have to focus in, what if I'm using the pain scale? Well, that also has a limitation, which means it's got to be 3 points or more. Obviously, if I say I'm a 7, I go to a 6, that means I'm better, but it's not considered significant. So if they start at 7, the next time you do it to really be considered significant, say on re-exam, it's got to be 4. So a 3-point difference. I would say then, obviously, those two factors are important. If you're not getting at least 7 or 3, you better focus in on something about an activity, particularly a home or work activity that they couldn't do before. What they care about is the patient getting better. Because remember, once they're stabilized, they have to be on a continuation care with flare-ups. So keep in mind, acupuncture works well. We need to demonstrate it. Show me on this general pain index, pain scale, or function how much improvement there is. Now, this brings me to, for some of you, and I've had this question a lot, is being part of the VA worth it? Well, does it cost anything to join? No. Do the patients sometimes have some hassles getting authorization? Yes, that's true. But when you're paid, let's go over it. If you're getting a standard episode of care for 12 and 8 visits, just say the first 20 visits in a year, considering just the treatment, that's probably $2,000 to $2,500. Now, even with taking out exams, is that worth it to me? Absolutely. However, am I frustrated with the exam part not being paid? I am. But at the same token, that's not going to stop me. But this is where, if you're not part of your state and national association, this is where we need to belong, because this is where we need to push back, because how are they treating us differently? Now, the downside is they are doing it to chiropractors, to physical therapists, as well as massage therapists. So it's not just you. But at the same token, I think it's valid to say that it should be covered, because how are you supposed to determine care without an exam? Because they're doing this based on a Medicare rule. Well, Medicare only sets the fees for the VA. It's not the protocol, because if that were true, they shouldn't pay for acupuncture at all unless it were chronic low back pain and under supervision. So we know that they're kind of just choosing and picking certain ones. So I think we're going to have a pretty good pushback, but I do still, it is worth it. If you're thinking, I'm not so sure, we are doing next month in August a whole seminar on the VA, what to do, how to make it work for you. Make sure you tune into that. Otherwise, I'm going to say to everyone, we always want to be your resource. If you're having issues, reach out to the American Acupuncture Council, the network specifically. We highlight updates right on our website. And if you're a member, it allows you to have direct interaction with me via calls and Zooms and otherwise. Until next time, my friend, be well.